If you have to seek perfection, I think it's the simplest thing is to do neurosurgery. So first and most important skill in any specialty is humility. Let me tell you one episode with Sunny Gavaskar. I play the old-fashioned cricket, which is with the straight bat. Shot
No
is only
360-degree shots.
No, usually not. The highway between Bombay and Goa is very close to my heart. My wife is from Goa and I drive that highway as often as I can.
It's a beautiful road.
Probably the best road in India. There are times that I go for surgery after a cricket game. There are times that I go for a game after surgery. I think it would be unfair for me to say that neurosurgery is the epitome of all surgical branches, but certainly it's the most unforgiving of all branches. I tell my general surgery colleagues that even if you left a mop in the abdomen, it'll be passed out in the stool somewhere. But that can't happen in the brain. I grew up in a family where music was always there. My father had a music system in each room. In fact, we had speakers of the music system even in the bathroom. In those days.
Are there any things you wish you should have done more in your MBBS days?
I should have played more cricket.
Advice for MBBS students out there?
I think first they should try to become emotionally stronger. By that I mean that they should be used to the tough life that is up ahead against. They need to be aware of different challenges that are there in modern society today. Also, I think it's really important for the youngsters. Try and see that they should know where they're headed in terms of their ultimate career, because time is very limited and the knowledge is getting really extensive. Lion of the Department of Anatomy, Dr. Chhatriwala, I enjoyed that posting thoroughly. I like probiotics. I think neurosurgeons can get stressed, so I like curds. I've driven to Kathmandu from Bombay. I've driven to Kanyakumari.
Padding up as a batsman or scrubbing in as a surgeon? Out of the two, which still excites you more today?
Oh, without doubt.
Hi everyone, welcome back to a brand new episode of the MADtherapy Sessions podcast. Our guest for today is Dr. Aadil Chagla. Dr. Chagla is currently the professor and head of department Neurosurgery at GS Medical College and KEM Hospital, Mumbai. It is one of the most prestigious departments in the medical field in the country. Dr. Chagla is also the only professor to represent the country in the WorldCup and certainly the only neurosurgeon in the world to represent his country in a World Cup, a feat repeated twice in 2020 Cape Town, South Africa and 2022 Queensland, Australia. The audio podcast is available on Spotify and Anchor. The links to that are in the description down below. Drop a like if you like this video and consider subscribing if you end up loving it. And also don't forget to comment down below your thoughts on the podcast. Till then, enjoy the episode. So Dr. Chagla, why did you choose to become a neurosurgeon?
Well, when I was barely 15 years old,
Okay.
I was in the bedroom. My dad wasn't keeping too well. He wasn't feeling well, so he said he'd like to lie down. So he went to his room, and it was about 9 or 10. I still remember it as if it was yesterday. And suddenly threw into a fit. He had a seizure. At that time, I didn't know the spelling of the word seizure. And he continued to have these jerky movements of various parts of the body, and his eyes were rolling upwards, and I couldn't make out. And I shouted, "Mama," and we all came and held him. My sister was by my side. My mother was holding his hand. And thankfully, he was lying down, so we didn't really need to do much more. And in a couple of, I would say, maybe a couple of minutes, it eased out, and we just thought that we should be comforting him. And my mum was then frantically dialing the doctor and the hospital, and we had to take him into the hospital.
Right.
In those years, we had no CT scan. MRI, of course, it was just not there. And we had very little in terms of treatment for something that was in the head.
Right.
And ever since that, and then we realized that he had cancer also in the brain, but it started from the stomach. So it not really stomach. Now we know that it's the large intestine. So he had a cancer of the large intestines, or the bowels, and then that had spread to the brain. And I lost him in about a few months, 8 months in fact, which was quite a struggle. It made me more determined that I'll become a brain surgeon. That's the reason why I took up neurosurgery.
It's like a complete backstory you have, which made you, gave you a push towards neurosurgery.
I mean, just imagine you're barely 15 years old.
Right.
I had plans to play Test cricket for India. I had plans to probably become an architect or a pilot because I liked speed, I liked cars, I liked planes, I liked art, I liked lots of outdoor stuff. And then to be cooped up in the four walls of the operating room every day of your life, that was quite a jolt when you're just so young.
Right.
That's made me more focused. It just helped me to remain as stable and as balanced and as focused as I possibly could through all these years to make me a neurosurgeon today.
So, how has been your journey so far, learning and experiencing neurosurgery?
I've been born and brought up. If you listen to a lot of my friends who have shared times together through thick and thin, they've seen me more on the cricket field than they've seen me behind books and libraries and attending class. And they would tell me, because they thought that I stayed in an area which was more affluent. Little did they know that I had to really fight through and continue to live in that surrounding, because we didn't want to let my parents down and try and move out from that same locality just because I didn't have a father. And it became quite tough that we had to do with whatever little resources we had, which actually drives you to a point that you want to succeed. Not only you want to succeed, you want to do well.
Right.
And you don't want to be dependent on anyone. So I think with that in mind, things fell into place with the grace of God, and I am what I am today.
So, what was the best thing you experienced while becoming a neurosurgeon?
Yeah, it's see, let me tell you, I remember when I finished my MBBS.
Right.
And I got selected to play for a team that was to tour Australia. So I was barely 24 years old. I just finished my MBBS. And I had to go to represent Bombay Gymkhana to Australia. And I played the first match. I got some runs. I remember we were supposed to play McDermott, but thankfully got picked. And being an opening batsman, you generally face the music. So after the game was over, we had a party, and gradually, when people realized that I'm going to be a neurosurgeon, the entire younger crowd moved off, and I was with all the senior blokes in the party. And I was wondering why I wasn't along with all the youngsters. It's just that you get a little more serious. Your life tends to pan out into a very serious focus. And everyone wants to see what you can achieve and what you can do as a neurosurgeon. Everyone has this aura about a neurosurgeon. And also when you're dealing with your patients, they put you on a pedestal because you're a neurosurgeon. So life definitely for any neurosurgeon is different from most specialties, even in medicine. And I think the important thing is to do a great job, because neurosurgery and the branch is a very unforgiving branch. There are no mistakes allowed. And if you look at the parallel of cricket, when I bat, if you make one mistake, you go back to the pavilion. And if you're an opening batsman, you twiddle your thumbs till the entire team gets out. So you probably wasted your day. So it just puts that same focus and that same resolve into your brain that you have to do well.
So when you say you can't afford to have mistakes, according to you, what are the skills needed to master neurosurgery?
I think the first and most important skill in any specialty is humility.
Humility.
And that will, when you realize that you have to understand that to get to the top, to understand, to get to where you are, there's a lot of hard work, a lot of focus, dedication, application, attitude, resolve, and of course education. You have to learn. But along with all these things, you also need a good mentor, you need a good surrounding, you need a good environment. So many factors do come into play to become a good neurosurgeon. But that humility is the one that actually shows you the way. And that also translates to this great game that I play, cricket. Because unless you bend down, like you say, you stoop and give respect to the bowler, he's going to get you out. So you have to play head down, as we call it in our school days. You have to literally bend your back and make sure that the ball doesn't get through the bat and pad. So your defense is the first thing that you learn when you play cricket, and which is exactly what neurosurgery is. First, to be safe, and then to take that matter ahead and make sure that you deliver what the patient expects of you, what the tumor is, and how you set about healing your patient or curing your patient.
Since you gave an example of cricket, one example was respecting the good balls.
Exactly.
And so, if given a chance, would you go back and do neurosurgery all over again?
Yeah, if I could tell the good Lord, don't let my father have metastatic brain disease, then maybe I wouldn't do neurosurgery. But now that had to happen, and I lost my dad in a few months after that, 8 months actually to be precise, and he was only 51, so I was little. We had many things around in the house. We had 5 cars. My father liked cars. We had a couple of projectors in the house. We had lots of gadgets. My father would have been crazy with all the kind of gadgetry that you see in today's world,
Right.
the IT world. And we had, I had a splitter where I could edit movies. At that age, we had 16mm projectors, 8mm projectors. We had movie cameras. And my father gave me this insight into, we had a piano at home, so I used to play music. I had the opportunity to paint, to draw. So lots of inputs into my upbringing, which all make a big part, play a big part in becoming a good neurosurgeon.
So you would do it all over again.
Absolutely.
I also read somewhere you said about establishing neuroscience centers in Western India.
Yeah, actually, I don't think Western India has anything dedicated to neurosciences per se.
Okay.
There are smaller centers which are good, but like the one that I'm heading right now at KEM Hospital is good, but it's not dedicated only neurosciences. We have neurosurgery, yes, but we don't have radiation. Radiation is across the street at Tata Memorial. Tata Memorial didn't have neurosurgery facilities. We used to go across and operate there for nearly 20 years. Now they have their own because of the magnitude of the problem. We have so many patients, and everyone needs some neurosurgical expertise at hand. You cannot wait for neurosurgeons across the road to come and sort out your problems.
Right.
So each one needs an in-house neurosurgeon as well. Plus, neurosurgery, along with all its complexities, is also a hands-on job where you actually save lives. Patient comes with hydrocephalus, which is water in the brain, and you need to tap the ventricle ASAP, otherwise the patient might cone, or there's a clot and you need to decompress the clot. So there are many instances, or the tumor is bled and you need to go in and operate the tumor. So you need a neurosurgery backup almost 24/7. In which case, we still probably need something in Western India which will address all these problems and more. Today, stroke units are coming up, which is again a very small part of the neurosurgical problem, but a far cry from what happens in the West, and that's probably because our GDP is only 1% compared to our population. For example, if you look at the GDP in health for the US,
So the GDP on healthcare is 1%.
yeah, it's just 1%. So you can imagine in the US, where the population is nothing in comparison with India, the GDP is 17%.
Wow.
So you can imagine, So I think we have a
huge
long way to
difference.
go. We have a long way to go. You cannot compare, but I can say this cross my heart that our results, even at KEM Hospital, are comparable with the best in the world.
That's amazing. So any particular reason why you think or how we can improve,
This setup?
the setups, the neuroscience centers, the healthcare centers across, say, right now, only the Western India?
I think there are lots of the Tata Group, for example, who established the Tata Hospital across the street of KM,
Right.
are doing a great job. So maybe more centers should look at conditions of the masses, not corporate hospitals, but actual teaching hospitals in collaboration with the government.
With the government, yeah.
They shouldn't be independent, and we shouldn't have huge expenses in the education of doctors.
Okay.
I firmly believe that we should be able to channelize specialties much earlier on. The basic sciences in the education of medicine should be more focused into what you want to become at the end of the day, rather than making it as general as it is today. And for example, if someone wants to do general practice, his life should be in the same mold. He should look at problems that affect the masses. He should be wise enough to diagnose a common cold or an appendix, rather than a huge problem like an intricate brain tumor. But having said that, he should know what a symptom of a brain tumor is, and he should be looking for some signs that might merit an MRI, for example. In spite of all these problems, the MRI appointment in Bombay, in the private sector, you can get within a couple of days. Unfortunately, the same cannot be said in the government sector. Now, if there's a patient who comes in for an MRI scan at KEM Hospital, he has a long wait list, which is not fair, which is akin to the same problems that they have in the West. If you want to run an MRI for a patient with a backache in, say, Europe, you have a wait list of more than maybe 3 weeks to 3 months. So the person just stays there with the agonizing pain. And I have had patients crawling out of their aircraft, so to speak, and come to the clinic because they can't keep waiting for the NHS to look after their backache. Each one has their own set of problems. I'm not saying that it's all rosy in the West, but I think the way forward would be first to increase the GDP without doubt, and to channelize the education of doctors of the future, so that we don't have unnecessary waste of time and money when there is so much to be addressed.
Right.
So much to be addressed.
I hope the government comes and implements a few of those as fast as possible, because
I'm sure they will, because I look at education as what we do for the future. That's why I like to be a teacher. But what is for the present is health. If the health of the masses is looked after, then they are happy, their productivity is better, the country is bound to progress, everyone is healthy.
Right.
But imagine if you're looking after people, they've got backache, they've got headache, they've got other aches and pains, their mental makeup is not positive. How on earth can such a huge population manage on a day-to-day basis? It's so difficult.
So we need better system to be put ASAP.
Yeah.
You mentioned a lot of cricketing analogies, and you're a huge cricketer yourself. So what was your first cricketing memory which you remember?
Oh, I started, I used to be going to what we used to call in Bombay tersi nets. They were nets that were held all the way after the rainy season would conclude, which used to be in the month of September, middle of September. They would have a small selection trial, and I made it to the tersi nets when I was very little. And my first coach was the great Sir, we call him Sir Bapu Natkani. And Bapu Natkani used to even chuck a few to me while he had others to bowl. He knew that I had a very compact defense. I was aggressive on the cover drive, and I also liked the sweep shot. I still remember that he was standing at square leg one day, and there was somebody throwing balls to me on the smallest net at the tersi nets. We used to have 4 nets. And I still remember people like Solkar, Gavaskar used to be in the 4th net, the senior net. And I swept the ball, and the ball was hit into the ground because we were taught to roll the wrists.
Right.
And I hit the ball bounced and hit Sir Bapu Natkani right in the crotch. And that is my first memory of the cricket ball. And he didn't flinch. He just applauded the sweep shot, and there was a wry smile on his face. And he went about his business. I still remember, so many people telling my mother or my parents, why are you putting him into nets at such a tender age? And they would say that this guy has no other interest, he just wants to play cricket. And I used to go there early morning. And then I would be dropped to school. So I've been going to tersi nets from when I was very little, practically from the first standard.
So you I mean, I would say a legend of the game itself. And you
Not
also
really.
have played with a lot of legends like Gavaskar, Sarkar, the great Sachin. I mean, how was it playing with them? I mean,
Let me tell you one episode with Sunny Gavaskar. It's the confidence level. In cricket, your mind is so powerfully involved with the sport that you play that it's almost impossible to disconnect. So I remember when Sunny was playing, we had the slightly sticky wicket. There was an exhibition game at Bombay Gym, and I was opening with him. And one ball kind of reared up, and he tried to play it down, not as successfully as anyone would have liked. So the ball took the thick edge and went between first and second slip, went for a boundary. And then in this typical waddle of Sunny Gavaskar, he would come tapping the wicket. And then obviously when you see the great man walk towards you, you walk and meet him halfway. So I went there, and he, without looking up, his typical white floppy cap, he would just say, "I always found the gaps." And then he went back. So you can just see the attitude. You're never beaten. You're never confused. You're so sure of what you want to do. And you achieve what you have to achieve. And that's what he did almost every time when he went to bat. And his records speak for himself.
yeah, and that's a deadly combination to have, like so much confidence backed with so much greatness. That's hard to beat, and he is what he is. He's the little master, the original little master.
Yes. I've learned a lot from him. In fact, when Sachin broke his record, I happened to meet him at the Bombay Gym dressing room, and I said, "Sir, I'm sure you can go and hit a couple of more centuries." So he smiled and said, "I can bat 2 sessions, but the third session may be a little difficult." And you can imagine how old he was at that time. So this is cricket and cricketers for you. Sachin himself is a jewel, and I've just played against him once. And he's always up to some mischief or the other. He's got that lovely smile, which is so boyish. And he's another great cricketer. I mean, everyone recognizes that.
So we come to the main point that you have represented India at the Veterans WorldCup recently in Australia. I mean, only a few lucky people can even say that. How was that experience for you?
I should have, or I would have been much happier playing Test cricket. That's a far cry. I still silently yearn that maybe I might be able to play the 4-day, 5-day match sometime. And right now, I don't think I can even last 2 days. So the 1-day match is tough.
You played for, represent India right now. I mean,
so,
it's
no,
at the World
I
Cup.
think God was kind to me. He said that, okay, you didn't play Test cricket, but you might be able to play the shorter version of the game. So I did play. I played reasonably well. A lot of the games are on YouTube, so people can watch me bat. And I joke around with my neurosurgical residents that if you watch me, you might forget Sachin Tendulkar. But honestly, I play the old-fashioned cricket, which is with the straight bat. And the horizontal bat shot
No
is only
360-degree shots and all that.
No, usually not. It's usually in the V in front of the wicket. It looks very elegant, and it's very pleasing to the eye, and especially to somebody who's a naturalist or somebody who plays the classical game. It looks very compact. The technique looks very solid. The probability of getting out is less. So there are advantages, yes, but the scoring rate definitely drops because your 360-degree doesn't happen. And the horizontal shot is used for the short ball or the ball that comes either waist high or above. It's very different cricket, and the quality of the bats have changed over the years, which has made scoring easier. You have a protective gear. In the times that I grew up, there was no helmet. Gavaskar played all his cricket without a helmet, and just in his fag end, he used something called a skull cap. Now just imagine if the ball had to take a nick from his bat and hit his face, he would be dead practically.
Right.
You're facing Malcolm Marshall, Andy Roberts, Holding, Clark, and who else, You've got so many quick bowlers.
Right.
And I think it's very difficult to compare different eras. I still think you need a special set of genes to play fast bowlers without any protective gear. And in those days, even the thigh pad was like, just a hanky in the pocket. And even the gloves were so weak that if you got the ball on the finger, the finger would be sore for a week at least. So I think it's very different, very, very different today. You've got so much of protection.
Right.
That I still remember when I was called on to look at Rishabh Pant after he was hit from a stark bouncer, which he pulled onto his helmet, and then he was caught out, so he came back. And Ravi Shastri was the manager, and I was on the neurosurgical panel at the Wankhede Stadium, so I was called to look at this guy who was quite dazed. We of course didn't allow him to go back to field, and as per the rules, thanks to a lot of unfortunate incidents in international cricket, he was sidelined for 2 weeks. Much against his wishes, he was quite keen to go back. And he seemed fit enough to go back. The helmet had taken the brunt, and we could see the depression on the helmet where the ball had struck. But the ball did hit him. He had a swelling, he had a bump, but luckily his scans were clean, everything was clean. Today he's healing from a road traffic accident, which is sad. Another thing on my bucket list of doing, which has been... Which is where I have thought of setting up these centers along highways to prevent accidents, or actually prevent secondary accidents. So prevent patients from not getting the necessary treatment or the required treatment so that they can be saved.
And a few pilot centers are already up and running.
Yes, we are very fortunate. We've had many people who've done that. And there's a group known as the Kaji Jal. There's Dharman. There's a kind of a NGO that helps in this. There's a Konkan development, another NGO. I started a small NGO with my father's memory called the Aadil Chagla Memorial Trust, which also has contributed. And we have Dr. Faisal, who is now running that place in a very polished manner. And we give him the necessary backing whenever required. And we're planning to set up similar centers every 100 kilometers. So we're developing the next one at Khed, then probably the next one between Lanja and so on. So the highway between Bombay and Goa is very close to my heart. My wife is from Goa, and I drive that highway as often as I can.
It's a beautiful road.
It's a beautiful road. Probably the best road in the country.
I mean, I keep telling everyone, you can take a flight to Goa, but if you drive down, there's nothing like it.
Yes.
You also mentioned your father's Memorial Trust, which also organized an InterCity medical tournament approved by the MCA.
The trust I thought of it because there were many people who I connected with who had a lot of respect for my father.
So
a lot of freebies came.
So there's a different cricket tournament by your father's name?
No. So the tournament I started because of multiple reasons. I love the game of cricket. I play the game of cricket. A lot of people know me. So I named the tournament only because it was very easy for people to relate. The MCA would definitely know the seriousness of the tournament. And there was no intermedical cricket tournament existing at that time. What made me very sad was our Bombay University affiliation was broken because we have what we call the Maharashtra University of Health, which is now in Nasik. So they have broken all ties with Bombay University. That means medical students, or for that matter, any student doing medicine or dentistry or whatever, cannot play university cricket from Bombay.
Okay. I didn't know that.
When that happened, they couldn't play the intercollegiate tournament, which is run by the Bombay University. So that means there was no cricket whatsoever. And I said, we grew up playing intermedical cricket. We grew up playing intercollegiate cricket. In fact, I got 100 in my first game, intercollegiate cricket. 125 not out, I still remember, across Maidan. Now, all this was gone. So I started this tournament 10 years ago. We couldn't hold the 10th edition, which we wanted to make on a bigger scale thanks to COVID. And hopefully this, maybe March, April, I intend to have it. And let's see, God willing, it will happen.
We'll be there.
I hope so.
Yeah.
But having said that, my mother is a badminton star. And in her respect, or in her or with her guidance, I intend to have an intermedical tournament for
badminton.
Badminton.
Okay.
So I intend to do that, and she's going to be 90 this year.
Wow.
The funny thing is we've been celebrating her 90th birthday for a number of years because different records have shown different birth date.
But you also mentioned she still plays.
She still plays badminton, which is remarkable. She plays a bit of tennis. In fact, I have just been informed that she's invited on the 26th for the flag hoisting and the tennis tournament of over 55, which she plays very, very seriously. So she'll be very happy to learn that she's been invited for that. This tournament I intend to have for the first time this year, between the 1st and the 3rd. And very, very kind of Bombay Gym to come forward and say that they will stage it for us.
That's amazing. The great Amol Majumdar, who is one of the greats of Ranji cricket and Bombay cricket, he once called you, I saw a video where he called you God in the room. Like, if there's one God, he's sitting with us and he referred to you. How did that feel when he said that to you?
I think it's very humbling again. And the reason I say it's very humbling is that this is the respect the medical profession has in this country. They akin doctors next to God, which is for everyone to understand that in India this is almost on a regular basis. And therefore, it is our moral responsibility to conduct ourselves accordingly. So there has to be honesty, there has to be commitment, and there has to be a sense of drive that will allow you this, let's say, privilege, because this is the faith in which most of our patients heal as well.
Right.
So the story is that I was playing a cricket match and Amol rang me up and said that his uncle was down with something very serious and he was unconscious and he needed help. So I did tell him that I had a game on hand, so that game had to be completed. But in the meantime, I didn't want to waste any time. So I gave him a whole long list of things to be done and I informed the hospital that they should carry those things. So by the time the match was done, all those formalities were over and I could straight away go and operate on Amol's uncle, and we were happy we could save him.
So you went from a cricket.
Yeah, so there are times that I go for surgery after a cricket game. There are times that I go for a game after surgery.
So that's a very normal thing for you apparently, where you directly go from a surgery room to a dressing room, from a dressing room to a surgery room.
Yeah, I have a story with the great Sir Achrekar, who was the Sachin Tendulkar coach, the famous Dronacharya of cricket. So I played for his team for 2 years after I came back as a neurosurgeon. So I was working as a lecturer in KEM Hospital. I beg your pardon. I was working as a lecturer in JJ Hospital, Grand Medical College, my alma mater. So I had operated through the night on Saturday. Sunday was the Kanga League match. The match was at Sasanian, which is the team that I was playing for. I played 2 years for Sasanian. We had youngsters like Amit Valaskar, etc., who were Ranji Trophy players who didn't play at that time in Ranji Trophy but went on to play Ranji Trophy. So we had a reasonably good team. But I hadn't slept the whole night. So as soon as I entered the tent at 8:30 in the morning, Achrekar Sir was already there. And he could notice that my eyes were red and I was, I didn't look, let's say normal. So I went to Achrekar Sir and I asked him, I said, "Sir, you have 20 members in the team, 18 members in the team. And I just want to tell you that I haven't slept the whole night." So he said, "Why are you telling me this?" So I said, "Sir, but you might want to." He said, "Why have you come to the ground?" I said, "To play the game." He said, "Then jolly well play the game." So that was Achrekar Sir.
I mean, you have been I would say custodian of cricket. You've seen the evolution of cricket. You've seen 3-4 decades or more cricket, the changes in cricket. So what's one thing you like about cricket in India and one thing you dislike about cricket in India?
I love cricket. So there's very little that I dislike of cricket. But I'll tell you a few things that have pained me over the years. One is, let me talk about the things that I love about the game. There's nothing like cricket. There's a song called "I Don't Like Cricket, I Love It." It's a 10cc song which I heard when I went to Australia this time, in fact, for the World Cup. So the game of cricket has taught me everything. Like I spoke about humility, when you really bend down and respect the bowler and you defend the ball back. And also when you get a half volley, you spank it to the boundary. So you know which ball to hit and which ball to leave. So that's pretty much similar to a relationship with anybody. You must know when to duck. You must know when not to try and hit a good ball, and you must know when you need to be aggressive. So it gives you an entire sphere, very much like what religion teaches you. So the laws of cricket are pretty evident, but most important is the spirit of the game and the way you play the game. So if I had to take a catch one lob, I don't think I could, even in today's scenario, appeal for a catch one lob. But if the rules allowed me to get a man out, if he was out of his crease, then I would try and knock the stumps down. But I think in the era that we grew up, we didn't do the monk cut. But today the rule allows it, the law allows it. So I think cricketers are justified in getting somebody run out in that manner. So that has changed. The gentlemanly nature of the game seems to have changed. I think it relates to the fact there's so much at stake. So that's bound to happen in a way. But what I dislike is that you've got this whole aura of match fixing which has tainted the game and has ruined the game. And that happens when there's a lot of money poured into the game, because the balance and the equations tend to change and the agenda is very different then. So that is what I dislike about the game today. And I'm not sure where it is going and how it's going to go. But I prefer to watch a Rohit Sharma innings today or a Virat Kohli. I don't bother what the result of the game happens, because we sometimes don't know what that is. But the technique and the way batsmen play is what I love to watch. And I like to watch the quick bowler running up from the boundary line, delivering even a bouncer or a yorker, and to see how the batsman copes with it. That's the beauty of the game.
Wow. So during the pandemic, when everyone was at home, I was on YouTube and I was watching a video where I came across a video of yours called Seeking Perfection.
Yeah.
And that intrigued me, and I saw the entire thing, and which is a very interesting topic you took out was importance of having a good mentor and guidance in medicine. So if you can elaborate a little bit on that, would be great.
I think in that TED talk which I gave on seeking perfection, and that was during the pandemic. I looked quite haggard and unkempt, got long hair, and I look something like Einstein probably. But nevertheless, the essence is that when you are trying to become perfect, you need someone to guide you to that, to mold yourself.
Right.
Because there are a lot of edges in your technique, a lot of let's say flaws that need to be rectified, and sometimes it's difficult for you to pick them up. You need someone from the outside to recognize these mistakes. And the same happens in a sport, the same happens in neurosurgery. I still remember the great Yasar Gill, who's the father of modern neurosurgery in this latter half of the last century. We dedicate that to the great Yasar Gill. He would guide some of the neurosurgeons, just sitting by and looking at their techniques and then telling them things.
Right.
And I was very fortunate that in my first presentation in the US, he was part of the audience, and he invited me over to Little Rock after I had my presentation. And in fact, he was looking through some of my operative videos when he invited me there. So it's a very humbling experience. I've been fortunate to meet some of the giants of the game of cricket. And I've been very fortunate to meet some of the giants in neurosurgery. And I've had a lot of time spent one-on-one with these great men just by good fortune, I would say, which is like the mentorship that one needs to become perfect.
Right.
So therefore I had to include that in that talk, that you need good mentorship. You need people to recognize these small flaws that might come about in your technique, in your treatment program, in something that might be so evident to somebody else, but may miss your gaze or miss your correction, and then you will make the same mistakes over and over again. Having said that, I think I'd like to make a small mention to one of the great teachers of neurosurgery in our own city of Mumbai, the great Dr. Dastoor. We lost him very recently, and we pay homage to him and his family. And I would just like to say a small episode when we had an interaction with him. It was a big meeting, and he is such a great man that he was doing some technique over years, and he must have been at least 70 plus when he mentioned to us that what he did over the years was not exactly correct, and he should change because science has changed over the years. So you can imagine he was 70 when he said that. And I'm told that his suturing technique was exactly like a sewing machine. He was so meticulous and so correct and so brilliant. And we owe a lot of our KEM, let's say, reputation thanks to his work and his efforts.
He has been a mentor for you, and you have been...
Well, not directly, because I never had the good fortune of working with him. He was far too senior to me. But he's obviously translated a lot to another very senior gentleman who I spoke to only today, Dr. Pandya. And then I worked with Dr. Pandya for a number of years, which also has been like a mentorship.
When you're on the path to seek perfection, there has to be someone to guide you to the right way. Or
I would say, when you say has to, yes. But in principle, even if he's not physically there, if you've imagined a person, and I would love to share the story of the famous Mahabharata, of the story of Eklavya, the ideal student, who has mastered the art of archery without the Dronacharya there, but he had his statue and he had his guidance. So, in principle, Dronacharya was there. He was the one who guided him to do what he did. So, yes, you need a mentor, but the mentor could be a physical form, it could be a person, it could be just a thought. But yes, you do need to create that in your mind.
Another fascinating point which I know about you is you prefer to be called as a professor over a doctor. Any particular reason why is that?
Multiple reasons. I think it's simpler because doctors are now being stoned and treated very badly. Professors aren't as yet, at least. No, but on a more serious note, there are two aspects of the medical practice that I do. One is I teach, and the second is I treat patients. So treatment I can do to very few patients. I might treat 6, I might operate maximum 4 to 6 a day. I mean, that's the max I've done. But I could definitely teach more than 6 people in a day. So, you're doing much more as a professor, you're teaching your skills, and that's a much wider access to heal patients in the end, because they will treat so many more. So if I teach these students, and teaching is for the future, we must always look at the future of the country, future of your family, future of a lot of things that surround you, because that is the way to move, that is the way to go. Whereas when I heal, I can heal just a few. So therefore I prefer the word professor before my name. And it's difficult to become a professor because you have to earn it. You have to do a lot of work. You have to work in a setup which is teaching, which is a medical college setup. So remunerations are very different. Private practice has a lot more income, but you don't become a professor generally. And if you have to become a professor, you have to be lucky that the institution you work also has a teaching facility. So these are some of the advantages, I would say, in choosing one over the other.
Understood. So what are the changes and say differences you have seen over the last few years after teaching hundreds of students?
Yeah. Now, I think in the initial phases, the entire set of people who took up medicine, in fact, when I took up neurosurgery, we were less than 10 neurosurgeons in the whole city of Bombay.
Wow.
Having said that, I can't remember a single student or a neurosurgeon who was actually from Bombay. Even some of the big names in the city of Bombay were from other places.
Okay.
And around. They were not really born and brought up in Bombay. So they came to Bombay because there were no neurosurgeons here. Having said that, there was not a single neurosurgeon in the whole of Gujarat. And our dean, which was the dean of KEM, Jivraj Mehta, he was invited by the then politician to become the first chief minister of Gujarat, who then invited one Professor Damani from, again, not from Bombay, to Gujarat to become a neurosurgeon there, because there was not a single neurosurgeon there. So you can imagine. So we've had even the famous Dr. Ginde, the Ram Ginde, who started neurosurgery facilities in a number of hospitals in Bombay, which included KEM Hospital, included Bombay Hospital, included Breach Candy Hospital, included Nanavati Hospital, Prince Ali Khan Hospital. So many centers in Bombay were started by the great Ram Ginde. He was from Belgaum, in fact a small village around Belgaum. So not many people were from Bombay because they had other, let's say, more, I wouldn't say just lucrative, but better options to have a living. The prognosis in neurosurgery in those days was not great, so the question of healing did not come. You were almost struggling every time.
Right.
I remember the stories of Dr. Dastu telling us that he would get the operation theatre after the entire surgery list was done, because the dean would say that anyway your patients are going to die. So you can imagine we've come a long way, where mortality was initially 80%, then it dropped to 40, 20, and probably when I took up neurosurgery it was around 10, and when I finished it was about 5. Today we are looking at 0.5 to 2, so we are definitely progressing as neurosurgeons.
That's astonishing figures right there, the progress you have seen over these years in your field itself. So just on that topic itself, how would you rate today's students compared to a lot of previous generations?
One thing for sure, they are a lot more smart. They are very smart. They know exactly where they are headed, what they want to do. Their academic ability, their scholastic ability is superior to what it used to be in the past. I also guess it's because of the ease of data or knowledge accessible at their fingertips. They can just click a button and get to know whatever they need to do. But having said that, they are not born tough. Their emotional stability or their emotional content in their makeup is not strong. So let's say you need to have a good combination. You need to be strong enough to weather the load of patients, the hard life that a doctor leads today, especially with the number of cases that are increasing, the hours of duty that he needs to spend in the hospital. So these are areas where they will need to cope up if they have to be good doctors. It's not easy.
Yeah.
So the emotional quotient is a little longer.
They have to toughen up a little bit.
I think that's the basic difference. So even when it comes to looking after these students, or we call them like kids, you have to be very gentle. You cannot be rough with them, because if they are, they tend to break down.
One question personally which I wanted to ask, because you have taught so many students, what motivates you as a teacher? After so many years, day in, day out, what motivates you as a teacher?
The beauty of teaching the kids is that they ask questions. Then you're always learning yourself. That's the first thing. Secondly, it's the easiest way to sharpen your own skills, because most of the times they have difficult queries, and then you have to provide solutions, because you're supposed to be the teacher, you're the master, you're the guide, and you have to make sure that whatever you teach them then translates to something that they can imbibe into their own, let's say, data bank, into their brain, so that they can also do similar kind of cases. And it should be able to blend in their system, so they should be able to acquire those skills. It shouldn't be that only I can operate and nobody else can operate. It shouldn't be that way. So that challenge is always there, because we were groomed with, let's say, fewer instruments, fewer props, as I call it. Today you have so many more gadgets with so many more props. You have a wand which tells you where the tumor is in the brain. So we call it the stealth. Then you have a stereotactic frame which guides you to a lesion, and it pinpoints exactly. So in those days we had to use our own skills and our own calculations in our brain. Today there are gadgets that do it. So of course there are many advantages, but there are also disadvantages.
Okay.
The beauty would be to blend the two to make you a robust neurosurgeon today.
Also, because of the pandemic, a lot of teaching shifted to a more digital platform.
True.
So how was the transition for you from the more traditional way of teaching?
One of my TED Talks was in that mode, but you don't get the feedback, so you tend to gesticulate more. You move your head, or you try to see whether you're creating that rapport.
Yeah.
It looks a little funny sometimes. Now I am reasonably still because you're there in front of me. If you were not, I would be trying to knock on the door and say, are you there still, or are you awake? So it's difficult. You can't make out what's happening to your audience. You don't have any feedback whatsoever to reassure you that you're actually talking sense, or whatever you're speaking is actually translating or getting registered with your audience. So I think it's tough for the person who's teaching, and equally tough for somebody to listen to somebody so far away. But that's only probably because we are used to the fact that we are always in touch with our students or our residents, etc. But when it comes to patient care, you have to be there with the patient. You have to touch the patient. You have to feel for the patient. You have to see the expression of the patient. And then you have to make sure that the patient heals. It's not just treating the patient. That
Right.
word heal is very important. And if doctors don't or lose the art of healing, then we are going to have a very sad and very unhealthy race in the future.
Also, when we move to the clinical side, a lot of neurosurgeons all over the country, from various parts of the country and abroad, ask for assistance and help from you. So you have to go and perform surgery sometimes to various parts.
Yeah.
And in places where it's a non-familiar place for you, with a different OT setup, different set of assistants, different instrumentation. So how do you cope up with that?
It's an interesting question that you put. I usually always say yes, and some of my colleagues know that I say yes because I love the challenge of doing a difficult surgery. I mean, that is the let's say the adrenaline drive, and it also gives me a chance to see another setup. And if you have to translate that to a cricket match, it's like playing in an away ground. I've played in Australia, I've played in Bangkok, I've played in East Africa, I've played in South Africa, I've played almost everywhere, Australia. So when you're playing on a different wicket, you have to adapt. So some wickets are bouncy, some wickets are flat. So the same with the setup there. You go with a mental makeup that you're going to do this. I carry my cricket bat and my kit everywhere I go. Even if it's for a neurosurgical exam, I have my cricket kit in my backpack. But on the other hand, same with my neurosurgery. I take the neurosurgery instruments, which are like my cricket bat and my gloves and things like that. And coincidentally, neurosurgery or any surgical branch is very similar to batting, because there also you wear your gloves. Here also you wear your gloves. There also you finish the match and you start oiling your bat and you scrape it and clean it. Here also I take my instrument, start cleaning it, keep it ready for the next case. So these are makeup things that tell you how you've gone through the case, what you need to do for the next case. So there's a lot of mental preparation when you're doing a challenging case, especially in a different scenario. And then you make sure that whatever that you don't get at home, you start making sure that you've got a backup plan.
Right.
If this nurse is not good at giving this, okay, I've got these things already lined up. Or if I need certain types of instruments, I made sure that I'm carrying those instruments. So you make sure that you've got things that are there to give you that confidence that you'll be able to achieve what you have to do.
Those are great analogies between cricket and neurosurgery, like the home and the away.
It's my daily routine.
Does that help you in your daily practice? Like, I mean, if there's
Yes,
a stressful
it does.
environment,
Absolutely.
but then the moment you make analogies with cricket, it just breaks it down into a more simpler process for you.
It's so funny. See, when you're batting, it's only you and the bowler. Even though if there's a huge crowd watching you or making noise or whatever, ultimately it's just you and the ball coming to you. That's it. The bowler, you watch his action, you start seeing the way the seam is, you see what the ball is doing, you see what the wicket is doing. In neurosurgery, it's you've got your micro instruments and you've got your target in front of you. The only difference is you're in an operating room and there are beeps of the patient or the beeps of the monitor going, and that's the music to your ears. So it's a very different scenario, yes. Different muscle skills are required, different muscle memories come into play. But at the end of the day, you have to concentrate and you can't get distracted at all. So the concentration levels are high, they supplement or they complement each other. Your fitness levels are high, they complement each other. Your focus is extremely important, so that complements each other. So you've got lots of parallels, and that's why I take my cricket as seriously as my neurosurgery.
Another fascinating point I heard about you and read about you basically is you've also assisted veterinary surgeons in dog surgeries.
Yeah, in my training as a neurosurgeon, I had to do a lot of dog experiments. In fact,
And
my
that
model
blew my mind. I mean that was the
no, I studied the canine model. During my neurosurgery, only because I had a model prepared as an experiment for my thesis, and because of that, I had a lot of knowledge of the canine model.
Mm-hmm.
And when I came back to Bombay after my neurosurgery, which I did in Sri Chitra Tirunal, I was invited by some friends to help in a veterinary surgery. It was a disc in a Dachshund.
Okay.
And the dog was paraplegic. They were going to put down the dog, and I said, no, don't do that. Let me remove the disc, and the dog should be fine. And the dog actually recovered power in both the lower limbs after about 4 or 5 weeks. And I got a message in 2 months that this dog has jumped and bit the neighbor's maid. So that was like a pat on the back for me. So, and after that, I've done all sorts of different operations on dogs whenever I've been invited by the veterinary surgeons. There are very few veterinary surgeons who actually do neuro for dogs, not in Bombay, not that I know of.
I mean, you must have treated hundreds of patients, or more than that, thousands. Any one fascinating story or inspirational story, anything which you can share, just one with us?
Yeah, I would love to talk about this story about a patient that lived in my building.
Okay.
And she was a young girl. I saw her at the age of 3. I used to see her in the lift going with her mom, and I used to tell the mother, I think, it was none of my business at that time, but I knew the family very well. I used to tell her, and she was a little younger than I was. Her parents were close to my parents, and we've all grown up together as kids. So when she was married and she had this young girl at 3, I said, look, I think you need to just watch this girl and probably just get a scan. And she was so young, and she then started to develop seizures, and then she had some weakness. By the time she was 5, she was having gross neurological deficits, and they brought her to me at the clinic. We had been allowed private practice from KEM, so I had a chance to see her in a private hospital. And I did mention that, look, this looks like what we call an arteriovenous malformation, which will require a surgical resection. Unfortunately, this was in a very critical area, and some other doctors along the way had already mentioned that if that was taken up, not only would she die, she would be grossly maimed, she would be paralyzed and whatnot. So they were always on the back foot, and being of a community which is very conservative, they were not really talking about surgery at all. So we lost more time, and by the time she actually came to me the second time was when she was bedridden. So she was on the bed. She was drooling saliva from one side of the face, and she could barely swallow. She was completely weak on one side also, and she was having 5 to 10 seizures a day. So she was pretty much gone. And with this in mind, I said, now we are, going to have a huge surgical challenge. Plus, there'll be a huge rehab program after that. But they came, and since I just said that I had given them that assurance that if she came to me, I'd look after her. I really wasn't keen to just say no. But almost everyone had given up on this case. And in fact, my wife was very keen that I didn't touch this case, because we live in the same building, and God forbid if she did, have the worst outcome. She would be facing the music because I leave early in the morning and I come late at night and I barely know what's happening in the building. So she said, I don't think that's a good idea. Just stay. Everyone has said that this is not a challenge. This is not even a case that one should attempt. Nevertheless, as most neurosurgeons are the way they are, we took up this challenge and I said, this is what we need to do. And even then they were not prepared. I had kept my whole Diwali vacation to look after her. But they chickened out and ultimately they said yes in the month of Jan-Feb. I must mention that that's the time when the time shield matches also come into play. And I play a lot more cricket. So to then think of this challenging case when I have cricket matches and net practices was almost an impossible challenge. So
Absolutely.
I was also a little bit on the back foot at that time. But nevertheless, as neurosurgeons love challenges and I particularly love them, I told her, okay, we will go ahead with this plan. They wanted some assurance. I'd send them to another doctor. There's something called a pre-op embolization. There were feeders from all the three major vessels of the brain, the anterior, middle and posterior cerebral arteries. So the anterior and the middle were more approachable surgically. So I requested my radiology colleagues to try and embolize what we call reduce the circulation from the posterior circulation. Unfortunately, during this procedure, they didn't use the posterior circulation. They used the MCA, which was actually very superficial for me to treat. And the catheter got clogged, means it got blocked. In those days, they had something called what we commonly call glue injection, and they have to pull the catheter out quite quickly. They couldn't do that, and the catheter got stuck. She got much worse after the procedure, and the procedure was abandoned. So we had a sick patient. We had a patient now who had problems with the procedure. So she was completely in a wreck and I was at the center of all this. So we had to still wait. We had to kind of get her out of this mess initially, and then I admitted her for the surgery ultimately about 15-20 days or almost a month after this procedure was done, which made it worse for my cricketing season, which was getting more and more interesting. And nevertheless, we decided on a Friday, and I operate my private cases after 4, that is in the evening, because in the morning I'm at KEM Hospital. So the morning of this day, I was driving to work, and since I stay at Breach Candy and the hospital of Breach Candy is very close to my house, I see the patients at about 8 o'clock before I go to work at 9 at the hospital, at the KEM Hospital. So on my way, I saw the grandmother of this girl walking towards Beach Candy, which is walkable distance from my house. So I just took the car on the side and I said, Auntie, I'm going to the hospital, I'll give you a lift. So she, folded her hands like this and said, this way or that way, don't keep the patient lingering in the middle. And I froze on the wheel, saying that please don't say something like that, because this is not the intent of the entire procedure, entire surgery. So please don't say something like this on the day that I'm going to operate on your granddaughter. She will be well. And we went to the hospital. I wrote my notes, my last clinical notes, and made the plan before I left for KEM. Finished the day and came back at 5 o'clock to organize the surgery again. We started at about 5:30. And the surgery went on till 5:30 in the morning the next day. So 12 hours I was operating on this AVM. And I managed to excise the AVM. I saw the catheter that had been left in situ, and of course that continued to remain there. The surgery was done quite well. I was very pleased. I told the relatives at about 5:30 when we finished. I settled the patient in the ICU, saying that she will require an ICU for a few days. And I told them that I'll come back and see the patient, but it'll only be after 5. I didn't tell them that I was going to play a cricket match. So I went home and I told my wife, just let me rest for about an hour. Wake me up if I've dozed off. So I slept from about 6 to 7. 7 I was getting ready. I informed the captain that I won't open, but I'd probably go one down if we are batting first. And went and played the match. We won the match and I scored a 50. So that's the story. The patient did very well. In fact, a little bit of the patient's video has also surfaced on that Seeking Perfection talk
Oh.
which is the girl. They're a very nice family. They stay in my building. They've given me all the permission to use that video whenever. In fact, they sent it to me for this talk, saying that we would be very happy for you to use it in case you need to. And the family is a very close family to me.
That's the epitome of
It's a long
inspiring
story,
patient.
but-
Yeah. No,
Yeah.
you can't get better than that.
Yeah, so this is neurosurgery, this is cricket.
There's nothing beyond that. You share an inspirational story. You are an inspiration yourself. A personal question: How do you seek perfection? Like how if anyone out there wants to improve as a physician, as a surgeon, how do you do that? How do we do that?
You need time. So to seek perfection, I don't know if you've heard of Leonardo da Vinci's story or you've heard of people like these greats. When you read about them, they've spent hours and hours. If you look at the painting of Mona Lisa, I'm sure he must have painted it over and over and over again. And because he's done that, he's got what is almost a perfect figure. And you need to spend time. So even in my batting, I like to spend time. I love to be there in the middle. And I like to see that my technique is the way it's supposed to be. And the same with neurosurgery. So the more correct you are, the less chance of making mistakes. And the more precise you get, the better your results will be. So, when we are making cuts on brain tissue, you've got millimeters between you and very eloquent areas. We cannot afford eloquent brain to be hurt at all. And yet you have to take out the disease or you have to tackle the disease. So there is a very small margin of error. If you have to seek perfection, I think it's the simplest thing is to do neurosurgery. So that's the way I look at it. And batting is pretty much like that. You watch Sunny Gavaskar practice his shots and he will tell you the same thing. And how in that split second he decides that this is the shot that's going to give me a boundary and this is the risk shot or there's no risk in this shot.
Right.
That risk factor that comes into play even in the surgical technique, you don't want any risks. You want to be absolutely safe and yet you want to challenge yourself to achieve that target. So even a race car driver driving at 300, taking a sharp turn, and he could skid off the road, he could ram into a barrier, he could knock off another colleague who's racing along with him. So everyone who seeks for this perfection, in fact, they have now video games, you can simulate the whole thing. So techniques make it easier for someone to achieve it. So today's techniques allow you to achieve that.
Right.
But unfortunately, you also need an attitude, which is not there. So unless you're pushed to the wall, that attitude doesn't come. So, you have two sides of the coin. And in everything in life, you have two sides of the coin. That's why I don't like to look at anything that's good or bad. Because both things you improve, both things you can learn, both things can help you. So for example, if you fail in something, that will teach you, probably teach you more.
Right.
And if you succeed, that will also help you because you get that high feeling that, okay, I did this and this is what made me succeed. So both things actually teach you. One may teach you more, but I guess both will at the end of the day make sure that you get to that perfect level. So all these things are small lessons. And start with small targets. I tell my students also, don't look at the big picture. Don't look at the big aneurysm that I did today. That will come. And in cricket, we use the same phrase. Look for the singles and the boundaries will come.
I absolutely love how you have managed to, I think the entire dictionary of neurosurgery and cricket has been, compounded by you in a beautiful way. And
it's my life.
So, how do you compare neurosurgery to other branches of medicine?
I think as a kid, I always wanted to be a neurosurgeon. So I never really paid much attention to other branches, but I learned a lot from other branches. I was very fortunate to work with a plastic surgeon in my very first surgical post, Dr. J. Shah. He was master plastic surgeon. His techniques are the ones that stead me in good time and good place even today. I've been fortunate to work with good general surgeons, their techniques. I had good urology seniors whose techniques we've had brilliant surgeons all around. In those days, there were few specialists or super specialist surgeons. There were mainly general surgeons who did other specialties as well. So a lot of these allowed me to develop skills which I can use in neurosurgery. So it gives you confidence. It also tells you that simple things can be done to achieve big results. And I've used those principles in my neurosurgical practice. But I think it would be unfair for me to say that neurosurgery is the epitome of all surgical branches, but certainly it's the most unforgiving of all branches. I tell my general surgery colleagues that even if you left a mop in the abdomen, it'll be passed out in the stool somehow. But that can't happen in the brain. So there is very little room for error. And that is the same for cricket. No room for error when you're opening the batting.
You've won, multiple awards, something like, the best neurosurgeon in Mumbai in 2013. You have been on radio multiple times. You've, the Brain and Spine Scholar Award. So how does it feel? Did it change your practice, or because it gave you more power, it added more responsibility? How did you take it as?
Let me tell you, any award is always a good pat on the back. It's a good factor. It's a good feel or a feel good factor, let's say. But that's not what drives you to do what you want to do. So the focus is not the award at all. That's the first point I'd like to make. And it is immaterial. You can put your hand up for various awards along the way. There are multiple national level awards, government awards, and all sorts of awards. I got the best paper award in my neurosurgery as the proffered paper when I was very young. And I used the thesis which I did, which I actually learned so much about the dog anatomy. And I remember this conference was in Bangalore way back in the 1994, and I got the best paper, or the best proffered paper award in the NSI, which is the Neurological Society of India. And a few of my colleagues, Chitras, had won these awards. So it was nice to share the podium with people who had already done this in the past. So certainly awards have their place. Having said that, the only award I got in my school was for art, for painting and drawing, and I liked art. So it wasn't scholastic abilities. But I remember a lot of my colleagues have got awards through their schooling careers. But that doesn't mean that you're going to be number one successful. So awards and success, or awards, happiness, they don't go hand in hand. It's just a pat on the back. It just makes you feel happy, yes. But that happiness will only translate if you can do something in the name of service. So if that's going to improve service, either in medical practice, the services to your patients, then it makes a difference. But if it's going to highlight you in a career or make you feel that, oh, because of this, I'm going to get some benefit, then the award loses its meaning. So at least for me, it's, I wouldn't say it's superficial, but I won't say that that's the reason why one would want to practice medicine or play cricket.
Understood.
The beauty of cricket is that you may have been the worst player in the team, but you could contribute a boundary, or you could take a brilliant catch, you could. So, and that catch might win the match. You may not get the man of the match. You may not have been the top scorer. Now, in Trivandrum, when I did my neurosurgery, I used to get a lot of man of the matches. That's because I used to open the batting and I used to bat 45 overs. So I always was the top scorer. But there might have been another player who got a critical wicket or a catch. And I used to tell them that, look, you guys have to understand that unfortunately, they look at the highest scorer or the one who's done, a lot in terms of
the numbers,
the numbers. But that's not the name of the game. And there's no point getting the numbers if you don't know how to play for your team. So I think a lot of life is learned on the cricket field.
You've put it rightly. It's like a pat on the back.
That's all it should take.
In fact, it should just humble you more. And
I think so. That if one realizes that, and it would be so much better for most people to learn to accept all their laurels and be grounded.
Right.
So that, it'll be easier to deal with everybody in life.
And you've spent a lot of years in KEM. as a professor, and now you are the head of department. So where do you see the department of neurosurgery going under your tenure, and
I in
in
fact
the near
had
future?
this question even from our very favorite municipal commissioner, saying, how do you see your department in future? So I am very keen that the department grows with subspecialties, and I've been trying to dedicate my entire team in that direction. So you have somebody who's an expert at epilepsy, you have someone who's expert at endovascular, you have somebody who's expert at endoscopy, you have someone who's expert at spine, and we've got a very robust team doing that, and I've given them a complete free hand, it's so that you can develop as you'd like to develop. So just imagine, you have the spine problem, we can tackle it. You have an endovascular problem, we can tackle it. You have an epilepsy problem, we can tackle it. So that was the idea. It's never happened before, and let people really excel in those fields so that we have the best hands in the country. And it's not difficult, just allowing these youngsters to grow the way they should be growing.
The future seems bright under your control, and would love to know more about it in the future as when it happens. Another love of yours, apart from neurosurgery and cricket, is music.
Oh yes.
So how did that happen? Because when you type your name on YouTube, there's a lot of videos of you playing the piano, performing at auditoriums. So I want to know more on that.
Let's say I grew up in a family where music was always there. My father had a music system in each room. In fact, we had speakers of the music system even in the bathroom. In those days, yeah. So you could have music all over the house. That was the first thing. Secondly, he himself, my dad used to play the clarinet. He also had a 16-piece band in those days, which used to win a lot of awards and prizes in different music events. There used to be a famous event at across the yacht club where there used to be a very rowdy bar where groups would be encouraged to play, and even in those places I have the trophies are still at home where my dad has won. He's cut records, so there's a lot of music in the genes already. Having said that, I have a niece who's an opera singer, and I have a nephew who's also playing the clarinet. So music is definitely in the family genes, and I just happen to be fortunate that we have a piano at home, and I've played it ever since I was little. So my first song was Moon Glow. I don't know if you've heard this song, but it's a jazz song. It was from a movie called Picnic, so it's the theme of the movie Picnic.
Okay.
And it's got lovely words, and when I used to be alone playing the piano, I would open the window and draw the curtains to see the moonlight fall into the bedroom or the hall and play the piano. We are fortunate that we have a couple of pianos so that I can play them.
Is there a recorded version of yours playing that particular song?
Yes, there is. In fact, it's on the YouTube in show called Over the Rainbow.
Okay,
so if you put my name and then you put Over the Rainbow on YouTube, you will hear that song.
Definitely going to check that out. You also secured 100% at the Trinity.
That I'm sure there are many who've done that. I think music is like maths, it's like 4 and 4 is equal to 8, 2 and 2 is 4. So if you can get your maths right, and I loved maths, music is not so difficult. So securing 100 at the Trinity is not difficult. What was difficult was we were very small when I did that. And that was the first time I got my name in the papers along with my name of my teacher, Arnold Saldana, who was he was a great teacher. And his most important words that even ring in my ear today, and I was barely 5, 6, 7, 8 when I learned to play the piano, was slowly, because you tend to run through things. And I use that critically to all my students even today. Do things slowly. Give time to your patients. This is what I like to say. If you give time, God will give you more time. So please don't rush through life. Take your time. See nature. See what good we have around you. Good into quotes. And try and imbibe something so that you can give back if you can imbibe. And this time is very important. And I always believe that if you do things slowly, you can really enjoy everything and probably even achieve to be perfect.
So, do you believe that cross training helps you during surgeries?
I think just not cross training, it's because your mind is open to so many avenues that you are very receptive. Now, cross training in athletics, now we realize that people who play cricket are playing football, basketball, they play some touch rugby. So you can use other skills to improve your level of fitness, because the center that really needs to be trained in sport and everything else when you're using your hand-eye coordination is the cerebellum. And being a neurosurgeon, we know how intricate the cerebellum is and what it does. Most specialties forget about that. They look at cognition, they look at the supratentorial, but there's a huge cerebellum that needs to be awakened in our system. And just today I realized one of my teachers was saying that he has a problem of ataxia. Ataxia is you can't balance yourself too well. And I did mention to him that I'll drop by and say hi to him. So hopefully I may be able to help him and help the cerebellum, because that's a huge part of the brain which tends to atrophy as we grow older a lot faster than other parts of the brain. That's because we don't use those skills.
Understood.
So I always tell people another thing, that if you stop driving, for example, and you have a driver, then start developing some other skills, because you've lost those skills for life. So always remember that when you're challenged to do things, you're actually protecting your own brain.
Understood.
So try and keep doing things, and the more difficult things you tell yourself to do at that age, you're actually protecting your own brain cells.
So we come back to the most earliest part of your MBBS days. I wanted to know, how was your MBBS experience?
For me, it was very tough. For me, it was very tough because I told my mom that if I played good cricket, I'd even take a drop in and see where my cricket career took me. But I was little. We had very meager financial resources. I'd lost my dad a few years before that. So everything was a challenge. And I didn't let my mind off cricket. So I used to keep playing. During my medical life, I used to practice with the Podar boys because they were the best team in intercollegiate cricket. We had Ravi Shastri, Shishir Hattangadi, Sharad Pednekar, all these giants of the game. We used to practice in the morning at Matunga gym. I used to go there, practice with these boys. And then in the afternoon at 3 o'clock, I would be at the Grand Medical College ground, which is now called the Police Gymkhana, and practice with the boys there. So I used to practice twice a day right through my medical career. Then I had to study, and I also used to play a lot of tournaments, so I used to miss a lot of work. I've missed my internals. I've got minus marks because of missing internals and got reprimanded very often, but I didn't stop playing. So that's what my medical life was like.
So are there any things you wish you should have done more in your MBBS days?
I should have played more cricket. But having said that, I think I did play a lot of cricket, and I did have all the opportunity to do what I had to do. But I missed my father, and I didn't spend enough time with my family because of this life that I led. These are the only things that I should have done. Spend time with my family.
One high, one low point of your MBBS days, if you can share with us.
Yeah, I remember speaking to one of my professors in the first MBBS.
Okay.
And I said, look, she said, you missed your internals. So I said, ma'am, I'm prepared to do them again. He said, sorry, you cannot get that. So I said, okay, I didn't mind, I lost all the marks. But little did I know that I would get negative marks. So I started my internals with -5. And I did pretty well in my final exams, but I didn't get distinction because I didn't get any internals, which was very sad. I found that a very sad thing. I would have been very happy to get distinction in one of my subjects in my first MBBS.
So that was the low point.
I think so.
A high point?
I played in a number of events for my college as a medical student, and we won the All India cricket number of times.
Wow.
And thankfully somebody has made a WhatsApp group of all our cricketers.
Wonderful.
And I try to post and stay in touch with them. Very, very fond memories. Many happy times.
Any advice for MBBS students out there which you would like to give? Students who are in MBBS.
Most of them are reasonably sharp. They know what they want to do. I think first they should try to become emotionally stronger. By that I mean that they should be used to the tough life that is up ahead against them. They need to be tough. they need to be aware of different challenges that are there in modern society today. And we read about them in the newspapers quite often, sometimes difficult to cope, difficult to understand, but we still need to cope with that. Also, I think it's extremely important for the youngsters to try and see that they should know where they're headed in terms of their ultimate career, because time is very limited and the knowledge is getting really extensive. In a neurosurgical specialty, for example, it may be better for them to concentrate on one area so that they can become experts at that, and they can deliver their best. Because it's in my time, I can still be a good microsurgeon, I can be a good spine surgeon, I can be a good say endoscopist or something like that, but the skills are going to multiply so quickly, and gadgetry is going to be so important that unless one knows how to use these gadgets and deliver, you're going to be left behind. So I think it's going to be important for them to specialize, subspecialize. We call it subspecialize.
One last point from my side which I wanted to ask you was, today's families are spending a lot on their kids' education, especially if they want to do MBBS in private colleges, and they end up spending more than what is required. What's your take on that?
Yeah, I think the sense of economics has changed a lot from our days and the days today. I'm sure big economists will say yes to the same scenario in whatever that they're doing. But the study of medicine has definitely become more expensive. So there are families that need to take loans, there are families that need to take scholarships and things like that. So, and when you put that figure in front of you, then your dynamics when you start your practice also change, which is a little difficult for me to follow, for me to understand or comprehend, because my MBBS, we were paying a meager, I remember, 235-45 rupees for 6-month fee.
Wow.
Then for my surgery it was 265, and we were earning as residents in those days, so it was paltry. And then my neurosurgery, I got admission in a national institute, I said Shri Chitra. So there I had a tuition fee of 100 rupees. In fact, no, the tuition fee was 25 rupees and the 100 rupee was the caution deposit which I got back when I finished my course. So there was practically nothing that I was paying.
Right.
So, and of course books were expensive, but we were allowed to Xerox them. Of course today you don't need to get books, you can probably buy them online or something like that, but I don't know. So we had a lot of Xeroxes, whether it was allowed or not, we don't know, but we were handed Xeroxes from our seniors. So we didn't really need to spend too much.
Right.
And so the expectations to earn anything did not happen in an immediate manner. But just imagine if I had a loan of say a couple of lakhs and I had to pay back in a certain period of time, what would I do?
Right.
So you're starting off with the back to the wall. So I think it's difficult. I'm not the best person to advise the younger generation. I think somewhere somebody has to step in and say this is not the best way forward.
A line has to be drawn.
Yes, I don't think they can spend obnoxious amounts.
It goes into crores right now, so I mean,
it's appalling. According to me, it's appalling.
Yeah.
Somebody has to draw a line somewhere.
Got it. So, I mean, we come to our last part. That's the rapid fire section where I ask you a few questions and you have to answer as fast as possible.
Sure.
Your favorite MBBS posting?
I like general surgery. My first posting under
General surgery.
A king, a lion of the Department of Anatomy, Dr. Chhatriwala. I enjoyed that posting thoroughly.
Any particular reason why did you enjoy that posting so much?
He was a remarkable man. He used to put challenges and used to always think of surgeons as lions. And he said you have to be lion-hearted. You have to have eyes of an eagle, hands of a lady's fingers he would call it, and the heart of a lion. And I think he groomed us into the surgical specialty the way one should get groomed into.
Okay. What's your comfort food?
I'm not a foodie at all. My wife tells my friends that if you give him boiled potatoes and boiled chicken, he's happy. But
I'm sure there must be something.
I like probiotics. I think neurosurgeons can get stressed, so I like curds and I like simple food, just nothing in particular.
Okay.
I like chocolates, but I'm controlled on my sugar habits, though my wife would not agree completely. And I certainly don't think that I need any spirits of any kind to put me into the mood. I'm pretty okay.
All right. Who's your inspiration and why? Well, you are an inspiration for a lot of people.
No, not really. I think I just like to lead a full life, and I try my best to do that. But the important thing is they have changed over the years. It's your father when you're a kid. Then you look at some of the famous cricketers that I was involved with, and then there are some neurosurgeons. But if you look at some real history, I look at things that I've read about Leonardo da Vinci, who would be a painter, he would be a sculptor, he would be somebody who could devise gadgets and, look at war victims. He was ambidextrous, he was good at fighting. He lived a life which one would be happy to even just imagine of.
He lived life.
Yeah, he lived life. The way I assume, I don't know. I mean, whatever little that I've seen and heard about him. So, until today, you have mysteries that shroud his paintings, his work. So that's amazing. What intrigues me maximum is that they say that 90 or 95 or 99% of his work is unfinished. That just shows you that he had no agenda. He just did it because it had to be done. And if it didn't get completed, it's okay. So what? Just do things. And I think that's the way one should live. No agenda.
Okay. Your favorite cricketing memory?
I think I remember hitting a couple of brilliant shots after I got 100 in the intermedical cricket finals.
This was way back in?
This is 1983, I think. 82.
Wow.
81, 82, 83, 84, I played some of my best cricket as a medical student. We won the Talia Khan Shield for Bombay Gymkhana as all members. I was in the team. I shared the dais with a number of prominent cricketers of the country, but I also was very proud that Bombay Gym won the Talia Khan Shield. 84, I got a Talia Khan Shield 100, so I was proud of that. And I think 82, 83, I won the Man of the Match, Best Batsman's Award in the intermedical finals, where I scored 159 not out. That was a knock that I really cherished. They used to call me Greg Chappell in those days. I had a similar flair. I had a beard and I used to have that doffy cap. Only thing, the color of the cap was maroon because I liked the West Indians a lot. But I liked the way the Australians played their cricket in those years. Today, I think they sledge and it's not cricket anymore. So I wouldn't dwell on that too much.
Your favorite pastime?
I like music a lot. I love jazz music. I play the piano.
Playing music?
So I prefer to play than to hear, but I also hear a lot. And unfortunately, with less time, I like to hear it in the car.
Okay. Any particular artist which you love to listen to recently?
I love Nat King Cole if it's a song or a ballad. He sings melancholy songs, so I like Nat King Cole. But I also like Oscar Peterson, who's the pianist. I like Artie Shaw, my dad's favorite clarinetist, Benny Goodman, Pete Fountain, so I like, and Coleman Hawkins on the tenor sax. So I like wind instruments. I like jazz music.
Okay.
Swing jazz, really.
Your favorite cricket ground to watch and to play?
Well, I like the Bombay Gymkhana without doubt. It's
the Bombay Gymkhana.
Pretty ground. I played a lot of cricket, got lots of hundreds. And played with some of the giants of the game, including Gavaskar, Viksarkar on that ground.
Now, this is my personal favorite. One road trip you wish to do in the future?
Oh, I want to drive to Jaisalmer from Bombay.
Jaisalmer from Bombay?
Yeah. I've driven to Kathmandu from Bombay. I've driven to Kanyakumari from
So Bombay to Kathmandu and Bombay to
Trivandrum. I've done the north-south of India.
Okay.
I haven't done east-west.
Okay.
But we were told that the east is a little difficult or dangerous to drive. I don't know. I've never been those roads. But north-south, yes, I've driven, and I drive to Goa very often whenever I get a chance to drive. So that's the reason why I've done this project on those highways, because they're difficult roads and a lot of blind turns, a lot of accidents. So the Bombay-Goa highway, but it's probably the most scenic view that I've pictured in a long time, and I love driving that road. National Highway 17, now renamed as 66.
Completely agree with you on that. Last one. Padding up as a batsman or scrubbing in as a surgeon? Out of the two, which still excites you more today?
Oh, without doubt. Getting my pads on and going to bat.
As a cricketer?
Absolutely.
I mean, that's your personality, which I had to make you choose between the two. And
But if I have to save a life, then I can't disregard the fact that that's my profession, that's
Right.
my job. I have to do that, so I'll have to say no to a cricket match. But if I'm given a choice and I can choose, then definitely I'll go and play a game, and I like to open. And of course, again, there are parallels. You wear gloves when you have to bat, you wear gloves when you have to operate. At the end of the day, you look after your kit, you start oiling your bat and clean it up. Same with the instruments again. So pretty much very similar.
That's about it, Dr.
Thank
Chagla,
you.
from my side on this podcast. It was lovely having you on this podcast.
I think I've spoken so much that people will get bored.
No,
listening
I
to
mean,
me.
there's too many topics to speak on, but this is like one of the first which we'll speak on, and it's been great. It's a broad insight in various aspects of your life, from teaching to neurosurgery to music to driving. To cricket and a lot more. I mean, there's a lot more to explore with you, and we've already spoken about doing different podcasts and different, like, you are a true Bombay boy, so would love to, do one in the car. You love your cars.
Yeah.
You also have a vintage car, so a lot of more things. So this was one of the first ones, and it's a privilege to have you on this podcast. And
Fine.
thank you for your time. I know you don't do this often. Forget the podcast, just traveling to this side of town, and because you're not because of anything else, but because of your schedule and everything. So it means a lot to me, to us, and to our listeners. And thank you for this. Thank you for the opportunity, and would love to have you again on the podcast soon.
Thank you. I mean, I've never heard someone speak so many praises in one breath. But I must be grateful to you. I'm happy that I can share some of my ideas and thoughts.
Absolutely.
And I certainly hope that our listeners would be happy to share some of my views.
Absolutely. I'm going to share the feedback with you soon as I start getting them. Thank you so much, Dr. Sir.
Thank you, Eric.
Thank you.
God bless.
Done. How was it?
Fabulous. Absolutely great. I think I didn't give you much time to speak.
No, I didn't want to speak itself. I mean, there are few topics which I had to skip.
Skip because I saw that. But things flowed like you said you wanted it to flow, which